Diabetes is a metabolic disease that leads to a high blood sugar or hyperglycemia. Insulin is a hormone naturally produced by beta cells of the pancreas. Insulin's function is to capture glucose in the blood and transport it into cells where it can be used as energy. If insulin doesn't function properly or isn't produced, then glucose will stay in the blood where it builds up, which is a bad thing. It will eventually cause damage to arteries, leading to atherosclerosis, which may lead to hypertension, heart attack, and peripheral vascular diseases. Now let's talk about the types of diabetes. Type 1, the juvenile diabetes or the insulin dependent. 5 to 10% of your cases will be of type 1. It usually affects children. It's insulin dependent, which means that this diabetes depends entirely on a lack of insulin production. Usually, a autoimmune reaction kills these beta cells which produce insulin. These patients have to take insulin synthetically. Also, since there is a insulin deficiency in this type, without insulin, no sugar inside cells, and cells needs energy. So in the absence of sugar, cells are burning lipids, which produces toxic ketone bodies, and this can result in ketone breath. Unfortunately, this type, there is no way to prevent it. All cases require insulin injection. Now let's talk about type 2, the adult diabetes or the non-insulin dependent. It's really common. 85 to 90% of cases are of type 2. It has adult onset, which means that it is the result of obesity, poor diet, or lack of exercise. This type is a non-insulin dependent, as I mentioned, which means that there is a insulin resistance. The body cannot use insulin properly. Most cases can be prevented by exercises and a good diet. Late stages may require insulin injection. Another type that I would like to mention is the gestational diabetes or the pregnancy diabetes. It occurs in pregnant women who doesn't have diabetes, and it is due to the placental hormones. It is usually a combination of type 1 and type 2. It usually resolves after the baby is delivered. Almost every disease has signs. So what are the signs of diabetes? We have sudden loss of weight, polyuria, polydipsia, and a tomato-like gingiva or a reddish gingiva. So as a dentist, what do I fear in diabetic patients? The most important thing is that diabetic patients has a high susceptibility to bleeding and infection. A really important point that I would like to mention is the difference between controlled and uncontrolled diabetic patients. The controlled diabetic patient who is taking his medicine regularly and had his breakfast. Any disturbance in these two factors, this patient is a uncontrolled diabetic patient. In other words, hypoglycemia, which means that he took his medicine without breakfast, hyperglycemia, which means he had his breakfast without taking the medicine. Let's move on to diabetes measurements or the lab investigations. First, we have the fasting blood sugar level, 8 to 10 hours of fasting, the random blood sugar level, and the glycated hemoglobin A1C or the HbA1c. The HbA1c, it gives indication for blood sugar level for the past 3 months. For the fasting blood sugar, the normal value will be 99 or below. The pre-diabetic patient will be from 100 to 125, and the diabetic patient will be from 126 or above. The HbA1c normal value will be below 5.7, the pre-diabetic from 5.7 to 6.4, and the diabetic patient will be 6.5 or above. Another test that I would like to talk about is the glucose tolerance test, also known as the oral glucose tolerance test. This test measures your body response to sugar. And here's how this test works. You will have the sweet drink, and then after 1 hour from drinking the glucose solution, the normal value is lower than 180. 2 hours after drinking it, the value should be lower than 155. 3 hours after drinking it, the value should be lower than 140. How to manage a controlled diabetic patient in your dental office. There is no need for preoperative antibiotic, early and first appointment, stress reduction protocol. Treatment procedure shouldn't be more than 20 to 30 minutes. Of course, anesthesia would be with adrenaline to reduce bleeding since diabetic patients has a high susceptibility to bleeding, and of course less traumatic procedures as diabetic patients have bad healing. Since the diabetic patients has a bleeding tendency, let's talk about how to stop bleeding or the local hemostatic measures. First, squeezing the socket, extraoral ice pack, vitamin K locally, oxidized cellulose, and hydrogen peroxide to block open capillaries. Finally, I will talk about treating uncontrolled diabetic patients, which should only be an emergency case, since it's really dangerous to treat uncontrolled diabetic patients since they have high susceptibility to bleeding and infection. So make sure that any uncontrolled diabetic patient should consult their doctor who has their diabetes under control. According to the American Dental Association, you will be giving preoperative antibiotic 2 grams of broad spectrum 20 to 3 minutes before procedure so that the patient is under the umbrella of antibiotic to avoid infection. In the Middle East, 2 grams of antibiotic probably will be not enough, so you will be given 3 grams of broad spectrum antibiotic 20 to 30 minutes before the procedure. Thank you for watching.